back so your thighs are completely supported, but your feet are still on the ground. Because you're going to forward bend like you're fainting. Like, so I need you to go to end range, so you need to open up your legs a little bit. So don't go until I tell you I'm ready. All right? It's what patients all day, you're like, wait till I'm ready. Because I need to get my hands in here. So you have nice thin shorts. So I can feel her PSIS bilaterally. I can feel that. If I have to, I go on skin and get there. Okay?
So Christy's on PSIS, even though this is a sacral test, because it's very hard to palpate sacral bases. So we've all agreed that the sacral base that is stiff will pull that PSIS. So it's really palpating PSIS.
So starting kind of top down, just fold forward and go all the way down. Put your hands in between your legs. Keep going. And I'm feeling symmetry of motion.
Look how Christy had to roll with her because she's got plenty of
Come on
motion.
back up. Okay. So I notice her, and if she's normal, they should just both go together. Okay. So they rotate down, flex. The side that moves first and furthest is the side that's hypomobile, and it's dragging that whole side of the pelvis with it. So that's the seated forward bending test.
You can
So we'll say,
forward more than once.
yep.
It's okay.
I can palpate multiple times, repeat. Maybe they do it, they have end range pain, they feel stiff, they do a bunch of them and it goes away. And that's just this, they're just maybe guarding somewhere.
Gunky.
And then once they let go, they're even. So if you do one and you don't see it, maybe do a few and make sure it doesn't show up. Because they're now moving better, or vice versa. Maybe it's positive and then it goes away. It's not really stuck, it's just they're not letting themselves move symmetrically the whole time. Okay?
Hey Christy, so did you have a side that was positive? Let's pretend.
The right side.
Okay, thank you.
Right side was stiff.
Okay. How are you gonna? What else are you gonna do to figure that out?
Oh, lay her on her stomach. You okay laying flat?
Yeah.
Okay. We'll take that out. You lay on your belly. And because I'm changing position, I might check in with your pain again, see how you're feeling. If there's any difference in your symptoms from weight bearing to non-weight bearing. Okay. And I'm going to do some palpation. So I thought I'm going to probably give her a little tug, kind of standardize things a little bit. So I'm going to bring her up so I have happy body mechanics. So you can feel a little tug here, too. All right. Now, what I'm going to do is I'm going to find the sacrum, and I'm going to do CPR on your butt. Okay. So there's the PSIS. I'm going to come right inside that, and there's
Right base PA.
Okay. And I'm going to compare that to her left side.
Left base PA.
Oh, that side seems to move a little bit better. This side feels stiff.
Just checking that again. Okay, right base feels hypomobile.
What do I feel down here at the right islet? That seems okay. And I can compare. So don't just do one and done and like go around the four corners and think you're done. It's okay to slide back and
Way
forth
around.
and just really say, boy, when I did that seated forward bending test, her right side jumped. And when I do these joint plays, I really feel like this right side feels stiff. Patient, do you feel that?
I ask that a lot. Does this feel different to you side to side? Yeah, it really does.
Yeah, because sometimes
Great.
people can kinesthetically feel. Okay? And again, as I'm pushing, does she have pain? So maybe if I'm on her left side, she's like, oh, that hurts, and I get a spasm end feel, and maybe that side's hypermobile because this one's hypo. I don't know. This is just one test in isolation. But I'm like, boy, I really think this right side feels stiff.
Okay, so time out. We did this on Friday. Her right side is her stiff side. Can we agree with that? Mm-hmm. So you can already say something. If she has a sacral torsion, you can already say something. You're halfway there. You can say she has a what? You can say she has a blank on left. Because you know the axis can't go through the stuck side. So she is stiff here. Here's my axis. So we know she has a blank on left sacral torsion. We just don't know if this is stuck forward or back.
So then I might pause and say, let's back up. Back up. You know, when I did her active range of motion, she didn't like extension. Okay, so extension was limited and painful. So now she doesn't like extension, and she's stiff on the right side.
What's your hypothesis? Before you even test it, just give yourself 10 seconds. Does not like extension.
Something on the left.
Blank on left. Which way do you think that base is stuck, and can you name it? Who wants to say it with confidence?
Right on left.
Correct.
Like that.
Correct. Right on left. She's stuck in counter nutation. She likes flexion. Her base does not want to go into nutation when she extends. So your hypothesis is she's got a right on left sacral torsion.
Okay.
Gotta confirm it.
So now I'm going to confirm that. So if I palpate her in neutral, she may not look asymmetric. She's really off axis, and her right base might feel more posterior. Okay? And I can look at her here, so I go base, ILA, underneath. Hold on, we'll tell you why you go underneath shortly, like later this week or next week. Okay? All right. So what I want to have you do is I'm going to have you go prone on elbows for me. So I can come back up to your base and just prop up on your elbows like you're reading a book. Just kind of relax there. Now, if she's normal, what should have happened? She's going into extension, so her sacrum should mutate. If this right side is stuck back, I'm going to feel the left one will have gone forward. She'll feel more asymmetrical in this position because it's stuck. Okay? And maybe your whole pelvis feels off. Should still feel okay underneath because she's not off axis. Okay, now, you know what child's pose is from yoga?
Yeah.
Okay, so I'm just going to put my thumbs here on your base, and you're just going to come back and get into child's pose for me. So she's going to rotate back and come into flexion. I'm going to palpate base. And if she has a normal, if she's stuck back here on the right, the left one's just going to jump up and meet it, so it's going to look symmetrical.
They're both going to counter nutate.
Okay? And then it's hard to palpate the ILA in this position because of the tension of the glutes and the fascia. So you just want to really, but you still get in the habit of base, ILA, ILA. Okay? And go back to neutral. So I've decided that she has a right on left sacral torsion based on my 3 clusters of findings. Something stiff, and it doesn't move. And she doesn't like extension. So right on left sacral torsion.